Hello dear listeners! In the next video you will get acquainted with the first aid for a child who does not have consciousness and breathing. We will also analyze how to give the victim a stable lateral position when the victim has regained breathing after first aid. The basic CPR template for adults can be safely used in children. Nevertheless, there is a child's algorithm that has its features. When you find a child, look around. Your safety is above all. If nothing threatens you, determine consciousness and breathing in the same way I've seen in previous videos. If you do not find consciousness and breathing in the child, call an ambulance immediately, following the call-in algorithm. If you are alone, you must perform CPR for at least 1 minute before you call for help. If there is a second lifeguard, then he must immediately call an ambulance. Before starting chest compressions, 5 artificial breaths should be taken. To do this, put one palm on the victim's forehead and hold his nose with the first and second fingers. Grab the lower jaw with the other hand's 2 fingers. Inspect the oral cavity for foreign objects and take 5 breaths. During artificial respiration in children under 1 year old, you must cover both their mouth and nose with your lips. When taking breaths, visually control the volume of air being blown in before the chest rises. After 5 breaths, it is necessary to free the chest from clothes and make 15 compressions. To pressure the chest, it is necessary to use 2 fingers for compressions in infant, 1 or both hands for compressions in children older than 1 year. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Squeeze the chest by at least 1/3, which corresponds to 4 centimeters in infants and 5 centimeters in older children. After 15 compressions, it is necessary to take 2 breaths after tilting the head back. The frequency of compressions is the same as in adults, 100-120 beats per minute with a ratio of 15 compressions to 2 breaths. Provide assistance until the ambulance comes or the child's vital functions are restored. You can use an automatic external defibrillator if there is one. Standard AED can be used in children over 8 years old. In children from 1 to 8 years old, it is necessary to use special safe adhesive electrodes or AED settings for children if there is available. In children younger than 1 year, AED can only be used if the manufacturer authorizes it. AED should be used in accordance with the manufacturer's instructions. In this case, special children electrodes will undoubtedly be required. So we examine the first aid in the absence of breathing and consciousness in children. Now we will look at transfer the victim with breathing and the lack of consciousness to a stable lateral position. To do this, perform the following actions. When you find the victim, look around. Your safety is above all. Determine his consciousness. If there is no consciousness, then proceed further according to the algorithm. Determine if the victim is breathing. If the victim is breathing, then take off glasses, if any. Kneel down next to the victim and make sure both of his legs are straight. Place the closest to your victim's hand at the right ankle of his body. Bend the elbow and turn the palm up. Transfer the father's hand through his chest and put it to the victim's cheek closer to you. Hold his hands in this position. With your free hand, grab the victim's father's knee joint and pull it up without lifting the leg from the ground. While holding your hand under his cheek, pull the father's leg to turn on his side. Make sure that the elbow of the father's hand is touching the other hand of the victim. Without moving your arm, set his leg up so that his pelvis and knees are bent at the right angle. Tilt the head back so that nothing obstructs the airway. Adjust the hand below the cheek, if necessary, to keep the head tilted back. Make sure your mouth is open and facing the floor. Regularly assess the presence of breathing for 10 seconds to determine if the victim is breathing normally. Every minute, repeat the breathing assessment until the ambulance arrives. If the victim does not breathe normally, turn him on his back and start CPR. Please note, if the victim has severe bleeding, at first stop the bleeding, only then move him to a recovery position. If it became necessary to put a pregnant woman in a recovery position, turn her over on her left side. If the victim is unconscious and you suspect a spinal injury, but it is clear that the person is breathing, do not move him to a recovery position. Stay close, control his breathing until the ambulance arrives. To sum up, in this lesson you learned how to provide first aid to children with a lack of consciousness and breathing and how to use AED in children. You also examined how to transfer the unconscious patient to a stable lateral position to provide respiration. To consolidate the material, watch a video on how to transfer the victim to a stable lateral position.
Are you okay? Do you need any help? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Hello? Emergency? We need help.